All right. Yep, it's going. Hi, everybody. My name is Kaylee Kilpatrick. I am an admissions counselor here at Sherman College of Chiropractic in Spartanburg, South Carolina. And I'm excited to share with you today some information about our campus and our program. It's a DC program that stands for Doctorate of Chiropractic. It would take you 3.5 years to complete, which is 14 quick quarters. They're very rigorous, very fast, but they're very thorough. So you're going to get everything you need to do to become a doctor of chiropractic. I'm joined on the call today with your fellow peer, Michael, who's going to ask us some questions, as well as Dr. Jorge Campos. He's our director of ROAR, which stands for Reach Out and Recruit here at Sherman College, which basically means he has a lot of friends around the entire world who are chiropractors, and he's ready to connect you to them if you'd like to shadow chiropractors. But he's also a chiropractor himself. So he's going to share with us, kick us off first, and share with us a little bit more about the profession in case you've never heard about chiropractic or what you could do with that career field in your life. So here we are. Dr. Campos, to you.
Thank you. Thank you very much. So lots of people, when they hear the word chiropractic, they think about cracking backs, cracking bones, back pain, headaches. And it's cool. I'm glad that chiropractic can help people to live a better life. But I definitely want to talk about how this profession started. I'll tell you a story very quickly. It was the year 1895, and there was this man in Davenport, Iowa. His name was D.D. Palmer. D.D. Palmer, he was a healer at the time, and he worked with his hands and many other things. And during that time, his janitor at the building where he worked, he was deaf. He couldn't hear anything from his right ear. And he told Dr. Palmer that he went deaf trying to pick up a heavy object, and he felt like a cracking sound on his shoulder back. And the next day, he couldn't hear anything from that ear. So when Dr. Palmer realized that, said, that's kind of weird. So he went ahead and palpated the spine, felt a little bump, something weird there, applied some pressure. There was a cracking sound. And after that, Harvey Lillard said, hey, Dr. Palmer, why are you being so loud? And Palmer was like, I'm not being loud at all. And then he said, wait a minute, I can hear the horseshoes on the street, because this is before even cars existed at the time. So he was super excited because after that adjustment, he recovered his hearing. It is very interesting when you think about that, because it doesn't really make sense that you're going to recover your hearing from a spinal manipulation. But Palmer thought he discovered the cure for deafness. So next day he put up a sign saying, we treat deafness. And lots of deaf people started coming, because also Harvey Lillard was telling everybody that he recovered his hearing. Well, lo and behold, after he checked a bunch of deaf people, no one else recovered their hearing. However, people reported different progress to symptoms they had. Like, for example, there was a person saying that their headaches went away. Another person that said, hey, I couldn't go to the bathroom in like days. And after the adjustment, I was able to go to the bathroom. People even reported like hemorrhoids disappeared after the adjustment to the spine. So when all of that happened, D.D. Palmer realized that it wasn't about deafness. It was about what's inside the spine, which is the nervous system, the central nervous system. So chiropractic is not about bones, it's not about joints, it's about nerve interference, making sure that your spine is well aligned, there's proper motion, so those nerves that come out of your spine can fire properly and maintain that communication brain body. What is interesting about the story of D.D. Palmer, like I said, it doesn't really make sense, because one of the main hearing nerve is a cochlear nerve, and it's a cranial nerve. It's not on your spine. But I am from Chile. I went to school here in the United States, and I practiced 10 years in Chile, in Patagonia. And what was interesting is twice it happened to me that people recovered their hearing after an adjustment. One was a guy, a lawyer, who was in a severe car crash. So he had like a whiplash injury, and he couldn't hear anything after his whiplash injury. and he was able to hear again. And the other one was a mom trying to pick up her son and a bunch of groceries, and it was very similar. What happened to Harvey Lillard, it happened to her. So, having said that, again, I wasn't there in Chile treating deafness. I was making sure that the spine is well aligned, that there's proper motion, and therefore there's no nerve interference. So, making sure that the brain body connection is as clear as possible. So that's pretty much the story about chiropractic. And because of that, in 10 years of practice, I encountered over 300 different conditions that got better after taking care of their spine. So, what I usually tell people is chiropractic doesn't really treat conditions, but it betters that communication brain body so your body can actually do what it does best, which is heal itself. Every time you have a little injury, a little wound, your body is going to start healing. Your body's really, really smart. It's really, really intelligent. So when we adjust the spine, we remove the interference and we allow the process of healing and adaptation to happen in a better way. So that's about it, the story of chiropractic.
So I guess going off of that, so how do you deal with different patients that come with you with some kind of condition with like scoliosis or any kind of like, disalignment with the spine? How do you guys approach that as a chiropractor?
Well, I can tell you something very interesting. I saw this girl. She had scoliosis. She came to my office. And other than having a scoliosis, she had severe low back pain. She was really irregular with his menstrual cycle. Also, she had a hard time going to the bathroom. She went to the bathroom like twice a week. And she also reported headaches. Those were the four main conditions that she had. And she had this scoliosis. So I started taking care of her and adjusting her. And after 3 months of care, she reported that all those symptoms were gone. And this is the interesting part of the story. She thought that her scoliosis was cured. So without my consent, well, not really consent, but without telling me, she went to see a medical doctor. She got x-rays from the medical doctor. And when we compared the old with the new x-ray, she only had a positive change of 5 degrees. In radiology conditions, 5 degrees is very minimal. It's very tiny. It would be like a couple little millimeters of change. So when she came to my office, she was a little disappointed because it's like, you know what? I've been here for 3 months, and I still have an scoliosis. There's only 5 degrees of change. So I listened to her, and then I asked her, okay, how are your headaches? Oh, they're gone. How's your menstrual cycle? It's normal. How's your low back pain? It's gone. Are you going to the bathroom? Every day. So I was like, okay, what's your question then? So all she needed to function better were those 5 degrees. So the purpose of chiropractic is not to actually treat or correct an scoliosis. We're super happy when that happens. And I've seen it. Like I've seen corrections of, I would, if I would say, I would call this 100. I've seen corrections of like 90%, like almost back to perfect. I've seen a kid, for example, that he wanted to join the military and he couldn't because he had scoliosis. And after we worked with him for a year, his body was able to adapt and the scoliosis was almost gone. And he's in the military right now. But again, my purpose was not to treat the scoliosis. My purpose was to balance the body, improve physiology, and make sure that the nervous system is working properly. And the body is the one that is going to make the change. But to be super honest with you, younger patients react very well to chiropractic care, and there's usually a really big correction. This happens before the bones are fused, before you stop growing. But adults, I don't see that much change unless you do a lot of work with them with also like other things like physical therapy and things like that. But having said that, I saw tremendous results with people suffering from different curves, scoliosis, rectification of the cervical spine, you name it.
Yeah, that was excellent analysis. I really appreciate that perspective of like saying that you're not trying to be the end all be all. I'm going to be the guy that's going to make the change for you, right? So when you're trying to basically kind of like assist and have the body adapt, do you recommend your patients to do a specific exercise program as well, or what else do you guys do?
Yeah, I love your questions, and this is me speaking, because there are other chiropractors that they specialize and they take extra courses on exercise and things like that. Because I didn't do that, I only focus of what I was really good at, which is the finding the subluxation and making the specific adjustment. And then after that, you know what I did? I asked the patient, "What do you like doing?" And some people would tell me, I like dancing. Other people, they told me, I like to ride bicycles. So I would encourage people to stay moving, to stay doing physical activities that they really enjoy. So I wasn't really in charge of physical rehab itself. Of course, I know a few exercises that is kind of like brushing your teeth, like I call it spinal hygiene. So I did teach those to my patients so they would stretch and do it every day so they keep their spine moving. But I would highly encourage them to go to professionals to keep working their bodies so they could do yoga, Pilates, martial arts, whatever they enjoy doing in life. I would really, really encourage them to do that, because to me, exercise is not only about like losing weight, it's about life. So I really encourage people to do exercise and be supervised by those that are actually experts in the matter.
So you typically, so like with that approach, you typically refer your patients to like a strength and conditioning professional, or maybe an athletic trainer if if you guys have that connection, or.
Sorry, there we go. Yeah, absolutely. So what I did is, like I said, I would find where the nerve interference was. I would adjust that, and if there was, let's say, an injury, I would send that person to rehab, to a physical therapist. If that person wanted to improve sport-wise, I would send them to a CrossFit gym or a strength and conditioning specialist. So yeah, I have a really, really big connection with everybody in the town that I work. So, and that was a good thing for me, because I was never stepping on someone else's toes. You know what I mean? I wasn't trying to do the job of another expert. So that kept a really, really good relationship with me and my city. So I was seeing in my office medical doctors, I was seeing physical therapists. So we had no problem, because all of us, we were doing our specific jobs.
And I think that's like somewhere where strength and conditioning can actually improve upon. I personally do see a lot of strength and conditioning professionals become physical therapists, and they just like make that combination, like they're a physical therapist and a CSCS. But I guess from my perspective, I feel like I've learned this concept in macroeconomics. If everybody specializes in one particular topic, then everybody ultimately benefits. If you just like drop the ego and just specialize in that topic, would you agree with that?
I agree 100%. Like, you really want to see the best, like who is the specialist. And to be honest with you, I'm glad you brought that up, because let me ask you, what do you think the difference is between a chiropractor and a physical therapist?
So I guess what I would say is, with the physical, I've worked in a physical therapy clinic before. They basically do like the initial evaluation. Um, they check their range of motion. They put them through an exercise prescription if they are able to do it, depending on their injury. And I guess from my understanding of what a chiropractor does is that they kind of do similar things, but they're able to like do more aggressive adjustments. That's just what I would think. Am I correct in that
Mhm.
thinking?
No, no, no. And I'm glad I asked that question, because that is a confusion that I get all the time. Sometimes I meet people who are physical therapists and they're not happy to meet me, because they think that I'm doing what they do, which is nothing farther from the truth. So to give you an example, to me, the main role, there are many roles, but the main role of a physical therapist is to identify an injury or a possible injury, and work with that patient on rehab and strengthen those muscles. So the purpose of physical therapy is to help someone to rehab, to have a better life through exercises and other things that the physical therapist does through modalities. The chiropractor has nothing to do with symptoms itself. So during my last 3 years of practice, I would say about 80% of people that I saw in my office, they had no symptoms, zero. They didn't have injuries, they didn't have symptoms. They came because previously they had problems, but because I was able to find where the nerve interference was, I call it the short circuit, correct that, I was able to help them have a better life. And then after that, just like the dentist tells you, I want to check your teeth every 6 months so they can stay clean and stay free of cavities. As a chiropractor, I did that with my patients. So after 7 years of a long career, I would say about 80% of the people that I was seeing, they had no symptoms. So physical therapy is about rehab and treating a condition. Chiropractic is about finding interference in the nervous system, regardless of the symptom or the condition that the person has. So I can see someone that is walking coming to my office, or I can see someone with absolutely zero symptoms and still make sure that their spine and nervous system is working properly.
So I guess like what kind of indications do you personally look for when you have a patient come to you? Like what are some of the first things that you look for in the initial eval to find if there's any interference with the nervous system?
Oh, absolutely. We do different tests. Some of those are neurological, like the walk with your eyes closed, open, see how your body, goes different directions. We looked at the posture. We do something that is palpation, static and dynamic. So I palpate with you, being, relaxed, but also I make you move and I palpate while you're moving. We also have instruments, especially thermography, that we run through the spine, and that's going to show me how the autonomic nervous system is working. So I want to see even temperatures throughout the spine. And if the temperatures are irregular, that means that your autonomic nervous system is not in balance. So we need to find out why. And finally, if there's anything unusual or if the technique requires it, I'm going to take x-rays as well to make sure that the spine is doing fine. So we don't wait for the person to have symptoms or suspect that they have a broken bone. We mostly, when we take those x-rays, is to actually look at the spine, look at the curves, and see what we can do for that person.
Thank you for that. That was, it's really cool how you guys, I didn't even realize that you guys were like mostly about like neurology and mostly about the spine, because from my understanding, I thought it was all about like, what people were saying, like basically like making those cracks and basically like maybe adjusting legs too and all those kinds of things. So
Yeah.
yeah.
Let me give you two short examples, just to give you an idea.
Sure.
Let's say I was in a car crash. My cervical spine was severely moved, so I have pinch nerves right here on my brachial plexus. So then you ask me to bring my arm up, and I try to do it, and I go like this, like I can barely do it. But after the adjustment, I correct that interference. So now the nerve connection is proper. And I ask the person to move their arm and they can do it normally like nothing ever happened. I've seen that like hundreds of times in practice. But let me put it the other way. Let's say that that person was playing baseball and the rotator cuff tore. I ask that person to bring their arm up and they're going to do this. They can barely do it because they have a tore rotator cuff. I could adjust the neck all day and this is going to change very little. That person needs rehab. So you see, same condition, but totally different causes. One cause was neurological and the other one was ligamentous and muscular. So two different professions taking care of the problem. And sometimes it's both. So sometimes the person is in a severe accident that they actually tear the rotator cuff, but they also have nerve interference. So I work together with a physical therapist to bring that person back to their normal potential. So that's probably the best explanation that I can give you about what we do.
I can add there, like, I think one good point with that example is how you don't have to, lots of times, I guess, when someone goes to a chiropractor, it's because they had some kind of injury or a car accident or something. But this view of healthcare is you're starting as an infant child, like the first day you're born, being seen by a chiropractor throughout your entire life through elderly age. You don't have to have some sort of problem happen to you to see a chiropractor and go through this type of preventative health care.
Yep, that is exactly right. That's the other beauty. Like the youngest person that I seen, they've been my own children. They were about 10 minutes old when I checked them, and I did adjust them both because if you have never seen a birth, it's really intense on the neck especially. So many problems in the future they begin at birth. So I checked both of my babies when they were 10 minutes old, and the oldest person I checked was 97. Yeah, 97. I always wanted to check someone 100 years old, but that never happened. That's one of my goals that I have in life. It's in the bucket list. So there's no age. Of course, it's different. Like you're not gonna crack a baby's neck by any means. They don't even have bones. They are all cartilage. So adjusting a baby is like touching a tomato at the store. Like very, very little pressure. Same with the elderly. You have to be very careful. But if you are a football player, 6'5", 260 pounds, no, I mean, I'm gonna bring the thunder on you because you're used to it. So of course the chiropractor needs to adapt to every single patient.
So I guess what kind of because like I imagine that this job is extremely hands-on, right? With making all these adjustments, and I can imagine that you would become prone to injury just like PTs would. So what kind of like techniques would you recommend for people that want to become chiropractors, and what suggestions would you make to make sure that they don't get injured on the job?
Yeah, that's a great question. No one ever asked it before, but it's a great question. There are different techniques, and like you said, some techniques are more physical, and you could like the most common injury in chiropractors are shoulders because you're always pushing down and bringing all that force towards your shoulder. So that's the most common injury in chiropractic itself, and that's why physical therapists are needed. You see, but having said that, there are so many techniques that are a lot easier on the body, so you can adapt your own body to different techniques. Like for example, if I'm adjusting a guy, I'm pretty big. I'm 6'2" and 220, so I'm a big dude. But if I'm adjusting someone bigger than me, I usually use techniques that require speed, but not so much pressure on my shoulders. And if I'm adjusting someone who's smaller than me, they usually move really nice and easy because I had the mass to do it. But having said that, especially at Sherman, we're very, very specific and careful with our technique. And that's why like the current students is 50-50, 50% males, 50% females. Because this is not about strength. It's not about being a brute. It's about being specific. And I'm telling you, some of the best adjustments I ever received were from females. It's like a super fast cat adjusting me, just speed and no force. And because of that, so many women now, they're becoming chiropractors, and they're very successful at what they do. They're very specific, and people usually trust them more because they look more friendly and delicate. But in reality, they are as good or better than the man. So right now we're 50-50 at school for the same reason.
Yeah, I guess what kind of characteristics do you define a successful chiropractor?
Number one is willing to serve. Every person has a spine. So if you're going to be a good chiropractor, you're going to be a busy chiropractor. The other thing is you got to have this willingness to become an entrepreneur. And what I mean by that is if you're a medical doctor or nurse, you hope to get hired by a hospital or a clinic. As a chiropractor, most likely you're going to open your own office, just like a dentist would do. And because of that, you need to know business. That has been a really big concern in our school. And because of that, we have a program that is called the G10 program, which is a business program inside the chiropractic program. And we teach you everything: where to get a loan, what tables to buy, how to advertise. And your entire career as a chiropractic student, you get those business classes. So by the time when you graduate, you actually know how to run a business. And then the name G10 stands for 10 years of practice, being able to pay back your student loans, because we want you also to be debt free. We want you to be happy and enjoy a prosperous life. So right now, as far as I know, we're the only chiropractic school in the world that is teaching a business program inside the chiropractic program, because we want our students to be successful.
Yeah, me personally, I haven't really heard of a physical therapy, a strength and conditioning program, or anything like that where uh, you have like a business background too. I mean, I do know graduate assistant positions where you could get a master's in sports management or get an MBA or something like that, but never heard of like a dual kind of education. So that does sound really unique and interesting. So I guess another question I have for you guys is, how's the COVID-19 pandemic kind of, has that changed, your curriculum, how you guys have practiced, et cetera?
Mm-hmm. I'll let Kelly answer that.
Sure. Yeah. So, like you mentioned, this profession is very hands-on. We want our students to be on the campus, and they want to be here to practice and have that extra time. Throughout spring, just like every other school, we were totally online. But this fall, we have a hybrid. So, right now for fall 2020, we have our students come into the campus 50% of the time. The other 50%, they're set up online. But going forward, like starting in our winter quarter, which is January, those students should be 100% fully back on the campus again. The transition to being hybrid and having like a few online classes was pretty seamless, because we have what we call our Sherman initiative. Every student that starts school at Sherman College receives an iPad, and all of the textbooks that a student needs, all the course materials, syllabi, anything professors need to push out to the students is through that iPad. So they were already set up anyway to work from home. So there's some talk that some classes, more like intro type stuff, might be still online in the future, because it just works so well for the students. But like the actual core of the curriculum is going to be on the campus. So. Oh, and I didn't mention our health clinic. So we do have a full service health clinic on the campus. It's a health center that serves Spartanburg community. So after your first half of the program, that latter half, students come and they are interns within the campus clinic. So that way you learn everything you need to know with actual patients and everything. Our clinic is still up and running and fully operating. So all those students who are at the intern level, they're still getting all those hours they need.
Yeah, that's a relief to know. And, I'm glad you guys have, made the necessary adjustments to adapt. And, I can imagine that it's been tough for everybody to adapt, but I guess you guys do what's necessary with like your curriculum. I guess, what are some of the biggest lessons you guys have learned through this change that COVID-19 has given us?
Well, not really lessons, but what I've seen is the passion that the student have, instead of like being, I don't know if I should use the word scared, but instead of being really concerned about this, which everybody should be. But what I'm trying to say here is that they just couldn't wait to get back on campus, because this is a hands-on profession, it's a service profession. So they were so excited and happy when we took all the precautions, and we were actually, if I'm not mistaken, the first chiropractic school opening back again, so we could have students in this hybrid model. The other thing is, like, right before this happened, like a couple years before, we did a program with Apple. So every student that starts our chiropractic program, they get an iPad, and in the iPad they have all the classes and also most of the books, like 90% of the books. So you don't actually have to buy books when you come to chiropractic college here. And because of that, we were already doing the distance learning. You know what I mean? So when COVID hit, we were prepared. Like, we had the classes online, we have everything ready to go. So yeah, it was difficult, but at the same time, it didn't hit us as hard at other schools, because we were ready. We were prepared for it. We were, I wouldn't say 100%, but I would say at least 80% ready for it.
80% is certainly better than 0%, which
Yeah.
was the case for, probably a good amount of schools in the country. So I guess like since you guys have been pretty successful from utilizing your system, uh, what kind of recommendations would you recommend for other programs to, kind of like, you know, get on a successful track for their students to become chiropractors?
Definitely I would say two things. Number one, invest in the students. So here at Sherman, when we receive money and help and more students, you see newer buildings, newer chiropractic tables, uh, everything. Honestly, that's why I quit practice and I decided to work for this school. Like they truly care about the students. Like they really invest on their students, and that's why you get a free iPad and this I Sherman initiative. And the other thing that I would suggest to any program is invest in chiropractic. Like we had this conversation at the beginning that like what's the difference between physical therapy and chiropractic, and I show you that what we do here is very different. It's unique. It's specific. Like you were saying, the importance of being an expert, and because of that, we're doing many things with technology. So instead of investing in the new rehab machine that another school, physical therapy school, may be using, for example, we have a new imaging machine that is called the Conbeam. It's called the CBCT scanner, Conbeam computerized tomography. So when you go to the dentist, they do a 3D scanner of your teeth, and they look amazing. So chiropractors at Sherman, they said, well, we should do the same for the cervical spine. So when they take your cervicals, they use this machine and they see your cervicals in ways that they never been seen before, not even in medicine. So right now we are the first school in the world developing this technology and creating the curriculum for the CBCT scanner. The other thing is some people just don't like the cracking sound, and I totally get it. And some people are scared to go to the chiropractor. So we're investing in other technologies to provide a specific adjustment without having that component. So right now we have, for example, a technology that is called EPIC, which is sound waves, that the sound wave will cause a vibration and will create the adjustment without even hearing a crack in your spine. So we're doing all these things to improve the specificity and quality of chiropractic care. And we're really, really invested in chiropractic. So that's the two things that I would suggest to any chiropractic college: invest in the students and invest in chiropractic.
Definitely an insightful answer. I guess I have one more for you guys. What would you recommend for students to do if they want to get into your program, or just looking at different kinds of professions throughout the field of exercise science?
Yeah, so our program specifically, like we mentioned at the very beginning, if you've never shadowed a chiropractor before, now's the time, no matter what year you are. Um, we know tons of chiropractors in your area. We can set you up to go check out what's happening in their office. And just like you've seen Dr. Campos today, like chiropractors are super friendly and very knowledgeable about what's going on in their office, about patients and just the field in general. So if you have questions, they're totally going to take you under their wing and really teach you what you need to think about to be able to decide if this profession might be for you. So that could be your first step. But if you're really thinking about coming to our program or thinking about our program specifically, in our admissions process, we would look for you to have all the prerequisites completed. So that would include 24 credits of life and physical sciences. So if you're in the exercise science program at Temple, that will set you up really well for this program, because it's basically, we're just looking for a balance between life and physical sciences. There's no set list of like, you must have Chem 1 and Chem 2, and it's more broad than that. So we look for a nice balance, 24 credits total. Half of those credits should have lab components, which most of your courses probably have them within like an exercise science major. Like I said, other majors would also set you up well. So biology, chemistry, people on pre-med track, those could be good to come into our school. The other credits, so There's actually 90 credits total that you need to start a chiropractic program, no matter what school that you're looking at. The other credits are just made up of humanities and social sciences. So really focus on the actual hard sciences, because when you come to our program, in our curriculum, obviously you're going to be very hands-on learning chiropractic techniques, but the other part of that includes doing the hard sciences again on a graduate level. So that's why we want you to be prepared in that way. So the anatomy and physiology, those type of courses will help you. And then finally, we look for around a 3.0 minimum GPA for our admissions, and which is standard across chiropractic schools. But say you're looking to come for a visit. You can come for a campus visit or a larger like open house event, which we call our Showcase Sherman Weekend. That's where you come to the campus for actually 3 whole days. So you fly down here on a Thursday night, you're here all day Friday, all day Saturday for programming. You get to do a palpation class, you get to meet faculty members, learn from different panels, you meet a ton of our students. We feed you the whole time. It's really fun time. The next one we're having is in November. It's actually filled up because with the COVID restrictions, we have capped the number of people to come, but the one following that will be February 18th and 19th. And either for the Showcase Sherman Weekend or just a regular campus visit, which is where you could come on a Tuesday or a Friday anytime throughout the year, we will pay for you to come down here. Because you are living in Pennsylvania, you live over 200 miles from the campus, we'll give you up to $300 towards your travel expenses, and then all the hotel. So for a campus visit, it'd be a 1-night stay, that's on us. For the Showcase Sherman, it'd be a 3-night stay, that's on us as well. So that's something to look forward to if you're looking at Sherman, but also, like we said, there's a ton of other, not too many other chiropractic schools, but you definitely want to look at multiple if you're looking into chiropractic, so you can really see where your philosophy may line up for your personal self versus the school. Sherman is very traditional in our approach to philosophy. So everything that we were saying throughout this video about our focus on the spine holds true. Some other chiropractic schools kind of shifted away from that. They might be more interested in mixed chiropractic. We do have graduates that leave Sherman and they work at different practices that have mixed chiropractic, but here in our curriculum, we're focused on the spine still. So that's something to keep in mind too when you're comparing the different schools and setting up your visits. But definitely, 1, shadow chiropractor if you haven't already. We'll put you in contact with someone. Then 2, come for your own visit here, because we'd love to see you here.
So great answer, and definitely appreciate the generosity. I think my colleague has a question. Correct? Yes.
Yeah, I do. I don't know why it says Michael Brown.
Second.
My name is Samuel. I know I showed up on the call a little bit late. I apologize for that. I lost track of time. I was doing some other activities.
Nice.
No problem.
But aside from Sherman College really caring about their students and really implementing what do you call it, like technology, I mentioned Georgie, I believe that's your name.
It's Jorge. Yeah, it's okay.
Jorge,
Yeah.
saying that you guys get iPads and stuff.
Yep.
As the students, what really separates you guys from the rest of the pack, like when it comes to chiropractic colleges?
Well, many things. Number one, I cannot claim it yet because we're doing the statistics, but I think we are one of the schools with the highest referral rate, which means if you're a chiropractor on the field, you're referring students to us. So I think we have like a 70% referral, which is pretty high, and it may be higher than that. But the other thing is really the why, like why you do what you do. Like over here, we really teach the philosophy of chiropractic, which is the body's a self-healing mechanism that it needs no interference to work properly. And when you're subluxated, when your nerves in your spine are impinged, interrupted, you cannot function 100%. So the nervous system, most people think about the nervous system, they think about pain, but the nervous system is in charge of your balance, your reflexes, your strength, your adaptation to the environment, temperature. So when you start working with the nervous system, you see amazing changes in people. So our students become really good at finding where their interference is, where the subluxation is, and they become really, really, really good adjusters. So I would say that's probably the number one thing that I would say as a chiropractor is that our guys, when they graduate, they're ready to conquer the world. Like they know what to do and how to fix it.
All right. Hold on, sorry.
It's all right.
I do have one more. I do have one more question.
Yeah.
We call currently right now as an exercise sports science major at Temple University. I'm really a business minded individual. I would like to consider myself an entrepreneur. So more so on the we call chiropractic standpoint. How do you guys help your students, create like kind of like a self brand for them, create like a self brand for themselves and market
Yeah.
themselves?
I gotcha. We just talked about, don't worry about it because you came in late. So I'll just tell you guys again. We are the only school in the country and probably in the world that has a program, a business program inside the chiropractic program. Because what happens is when you're a medical doctor or a nurse, you're hoping to get hired by a hospital, by a clinic. Very few doctors open their own practice. Here, as a chiropractor, it's just like a dentist. Like most likely you are going to open your own practice, but we don't want you to fail. For that reason, from day one, you have business classes inside the chiropractic program. We call it the G10 program because we want you to be able to be successful and know where to get a loan, what equipment to buy, how to advertise. We give you all those tools so when you graduate, you'll be able to pay your student loans back in 10 years. That's why we call it G10 program. So if you follow that program, you should be able to do it. So yeah, we have a business. I would call it a business degree because it's not, but it's a business program inside the chiropractic curriculum. So that way you can use it when you graduate. So you get your diploma, and the very next day you're ready to open up your own business because you already have the tools to do it.
That's a great answer, Jorge.
Yeah, my pleasure.
All right, I think that's all we've got for today. I just appreciate you, Kaylee and Jorge from Sherman College. Thank you so much for taking the time out of your day to explain your program, everything about chiropractic practices, and just what the career is all about. We just appreciate your time, and Temple University's Exercise and Sports Science Association would just like to say thank you.
Yeah, not a problem, guys. And can you give me like 2 minutes because I wanted to share one last thing with you guys.
Yeah, of
And,
course.
it goes beyond chiropractic. It's about like choosing your own career, like your own path. I couldn't be happier myself to be a chiropractor. I think I was born to do this. And when I was practicing, I'm from Chile, and I was practicing in Patagonia, close to Antarctica. And I went to a radio show. I talked about chiropractic, and because of that, I got like 30 new patients that week. And one of those patients was a guy that traveled 3 hours to see me. He came from the mountains. He was a farmer, and the guy was very shy. He barely talked. And the wife actually was the one that gave me the history of the patient. The guy came walking to the office, barely walking, like dragging both legs, and in a lot of pain. The wife told me that he already had 2 spinal surgeries, lots of rehab, and there were no changes in his life. And he was wondering if I could help him as a chiropractor. My honest answer was, I don't know, but I'm going to find where the interference is, and I'm going to remove that, and hopefully his body will work better. After, I would say, 45 days of care, he came back to the office walking normally, like nothing ever happened. I adjusted him. And after the adjustment, he gets off the table, and for first time, really, he talks to me. And he goes like this, and he says, Doctor, thank you for saving my life. So I kind of like laughed. This was my first year of practice, and I laughed. I said, come on, man, I didn't save your life. I know you were hurting, you have bilateral sciatica, but that wasn't going to kill you. But right after I said that, the guy looked at me like really upset. And then I looked at the wife, and the wife was sitting there crying. And it's like, what did I do? So he looks at me and says, no, doctor, you really saved my life because I already went through 2 spinal surgeries. I wasn't getting better, and I felt that I was a burden to my family. I was hurting every day. So that day, I went to my room, I locked the door, I grabbed my gun, and I was going to shoot myself because I was done with life. And right before I pulled the trigger, my wife came and knocked on the door and said, "Honey, there's a guy on the radio talking about the spine." And I went downstairs, I listened to you, and I didn't pull the trigger. And now I'm alive. So you really saved my life. So when the guy said that, I realized that people, when they're suffering, they make the dumbest mistakes. They make the dumbest decisions, really. And because of that, they will suffer and their families will suffer. And I remember that day because I spoke with a lot of passion about what I do. And because of that, the guy came to see me. If I just showed up to the radio like, yeah, I'm here, yeah, I do this and that, I don't think I would have made a difference. So whatever you decide to do in life, physical therapy, medical school, chiropractic, whatever you decide to do it, make sure that it is a passion. It's not a job. Because when it is a passion, you're going to be able to change lives, and not only change lives, you're going to be able to save lives. So that's important for you guys. So please look at your options. Please make an informed decision. And once you pick something, make sure that it's going to be something that is going to give you passion every day to do it, like chiropractic is for me.
I think that's the best way to end this call. That passion that you guys have just displayed today is contagious. It really is. And we appreciated hearing that perspective from you guys. And I'm glad that you were in that position to ultimately save that guy's life. There's really no way to describe that effect that you had on that person's life at all. But the value of life is really something else, and that's something that we just can't take for granted at all. So thank you guys again. That was an amazing talk. Thank you.
Yeah, my pleasure. Thank you guys for having us over, and
Thank you.
thank you for sharing the
arranging
interview online as well. We
it.
appreciate that.
Oh, thank you guys. No.
No
Yeah,
problem.
thank you.
You have our contact information. If anyone in your organization wants to talk or come visit or just connect via a video thing again, we can certainly do that. So we're happy to help.
Sounds good to me. And as I've said before, we will post this video on YouTube for anybody that has missed out for today, but not a problem at all, since if anybody watches this video, then they can contact Sherman College, and I know with Kaylee, she'll respond immediately. So great. Thank you guys again.
All right, guys.
You're
Have a
welcome.
great day.
Have a good day.
Have a great day. Thank you.
Bye.
Bye.
Oh.